No, mai haere mai, welcome to 3 News. And remember, be kind. It's a phrase that probably still triggers many Kiwis. And today, the government's COVID response and in particular vaccine mandates were in the spotlight. The first phase of the Royal Commission of Inquiry was presented to government, and it found the mandates affected trust and social cohesion in ways that may make future pandemic responses more difficult. The 700-page report says while many of the decisions the government made were understandable at the time, in hindsight, things could have been done better. The determined focus on an elimination strategy prevented the government considering non-health matters like the economic and societal impacts. It says lockdowns were effective in the beginning, eventually allowing more freedom than many other countries, but they disproportionately impacted some people. And the repeated lockdowns on Auckland had wide implications on physical and mental health and wellbeing, educational outcomes and social cohesion. And MIQ took a significant toll on the country due to demand well outstripping capacity. Senior political correspondent Jenna Lynch reports.
It came so suddenly, the shock, the fear.
Tens of thousands of New Zealanders will die.
The lockdown.
These decisions will place the most significant restrictions on New Zealanders' movements in modern history.
And the verdict is in.
The approach that New Zealand used did save thousands of lives.
The first phase of the Royal Commission of Inquiry into New Zealand's COVID response is complete. The early response was hailed. The strict lockdown orders meant we enjoyed many more days of freedom than the rest of the world. But to achieve that, there was a lot of pain.
Harm was done. People were hurt.
Harm from what?
Well, they couldn't get back into the country to see their dying relative. They couldn't go to the hospital even though they lived in the same town because of the lockdown at the time.
The inquiry spoke with people across the Motu about that harm.
My experience during those years was the loss of bodily autonomy that many people felt that they were experiencing.
They totally overreacted and punished Auckland beyond reason.
It was deeply confronting for me that my own country wouldn't let me in.
The harsh border restrictions took a significant toll. MIQ requirements didn't start lifting until the end of February 2022, at which point COVID was freely circulating in Aotearoa.
As COVID carried on, New Zealand stayed locked down too long and were too slow coming out of it.
I don't think we're talking months, but I think there could be weeks of difference. And I recognise for those families who are, experienced that, those weeks could have made a big difference.
The report found that in the beginning the government made hard decisions quickly under pressure, but a determined focus to keep pursuing an elimination strategy and a lack of strategic planning for the longer term meant weighing up health with social and economic objectives was limited.
I think we found long-term strategic decisions really difficult right the way through the pandemic because everything kept changing so rapidly.
We didn't get everything right, and we can certainly have done better. And that proportionality of things like mandates and lockdowns.
And the mandates took a massive toll. The report found the mandates were applied too broadly and remained in place for too long. This caused harm to individuals and families and contributed to loss of social capital.
I think the two most difficult sets of decisions during the whole COVID response were around border restrictions and vaccination. I don't think they were a mistake, but I do acknowledge they came at a very big cost.
Whether people think that those costs and harms were acceptable and appropriate because the overall totality was better or not, there's a huge diversity of view on that.
At what point did you recognise that the response was affecting social cohesion?
It was pretty obvious to everybody who saw the number of people out the front, occupying Parliament, that social cohesion. No, I think we were starting to see it at the end of that Auckland lockdown period.
The once pretty united team of 5 million fractured. People lost jobs, families fought, friendships were torn apart, fires were lit, social cohesion was broken.
It was a pretty divisive time towards the end there, as was evidenced by the parliamentary protests, and there'll be a range of views on all sides of it.
We had very large groups of people refusing to go to work unless everybody in their workplace was vaccinated. I know everybody forgets that now, but that was actually one of the things that the government had to weigh up at the time.
The inquiry ruled the occupation of Parliament represented the most significant civil unrest in New Zealand for some time. It is likely to have far-reaching social consequences, it said.
Why didn't I go and talk to them? I think that was pretty obvious. When they have a noose hanging at the front of the protest with my name on it, would you go and speak to them?
But did it have to get to that point? Did it have to get to the point of nooses? Was there something that the government could have done earlier to acknowledge the concerns of those who were, a lot of them were really scared?
Yeah, a lot of people were scared right the way through the response.
The loss of trust in government due to some of the later decisions and the impact of mandates would make future pandemic responses more difficult, and no one knows when that might be.
The next pandemic that's as bad as COVID might be a couple of decades away, but it might be tomorrow.
We can only hope it isn't.
Well, for more on the Royal Commission into the country's COVID response, Jenna Lynch joins us now from Parliament. Jenna, what's next? Where to from here?
Yeah, so this is just phase one done. The Royal Commission of Inquiry was set up by the previous Labour government, and when this government was elected, the two minor parties in particular had problems with both the terms of reference. They thought it was too narrow, and also they had a problem with Tony Blakely, the chair, who was in that story, chairing the Royal Commission. Now, that was because he was an epidemiologist, and while he wasn't intimately involved in our COVID response, he did provide some advice and feedback to Sir Ashley Bloomfield, who was then Director General of Health and ran a lot of our COVID response. So they have implemented a phase two of the inquiry with a broader scope and different commissioners. The broader scope, the main difference is it will look at vaccine efficacy, vaccine harm and adverse effects of their vaccine, and have a particular focus on those long lockdowns at the end of 2021 in Auckland and Northland. Now, phase two of the inquiry is due to report back in February 2026.